Kalamazoo's Morning News, time for our Bronson Health Chat. Dr. Chris, I don't think a health chat's been so welcome just to get us away from the election cycle. I have to tell you the truth. We have had Dr. Chris on us with before. Dr. David Christ is an orthopedic physician and surgeon with Bronson Orthopedic and Joint Specialist. Welcome back. How are you?
I'm doing well, thank you.
Nice to have you back, sir.
Appreciate it.
All right, so let's talk all about hip pain, hip surgery, and whatnot, because there's an event coming up at the Bronson Athletic Club, and we'll get to that in a few minutes. But I guess what I want to ask you first, what are the major causes of hip pain, Dr. Christ?
Well, the thing that I deal with the most, of course, is hip arthritis, and that's where the joint is actually worn out. The cartilage that lines the hip socket and covers the ball eventually wears away, and then the hip becomes bone on bone, and the symptoms of that are stiffness, pain, which people usually feel in the groin and kind of down the front of their thigh, and difficulty getting their shoes and socks on and walking and doing those things. There are lots of other causes of hip pain, which are more on the muscle tendon side, the tendonitis, the bursitis, the hip pointer, that kind of thing.
Dr. Christ, what are the surgical and non-surgical options for treatment for this?
So in terms of non-surgical options, sometimes you injure yourself. It's good to just wait and see if it gets better. So a little tincture of time is always a good idea. Physical therapy can help, exercise, sometimes medicine, such as arthritic medicines, non-steroidal anti-inflammatories, or just things like Tylenol. Sometimes localized injections can be used to get people some time.
So if surgery is needed, what are the options, and particularly this one that I think is going to be featured, and that's the anterior hip approach?
So hip replacement surgery is an operation where we trade out the biological ball and socket you were born with, if you will, for a mechanical one that's truly artificial. Nowadays, usually a metal against plastic or a ceramic against plastic articulation, ceramic ball, plastic liner in the socket. And arguably is the best operation we have in all in medicine, no matter how it's performed. So we've got about 50 years of experience now, and I think we just keep getting better at the same original idea. The anterior approach is describing where the incision is made, and the interval that you go through, the opening to access the hip, anterior implies front, involves less dissection or less disruption of normal tissue to get there. So patients seem to experience a quicker recovery. So if you were to ask particularly patients who have had one hip surgery some other way and another one anterior, it's almost universal that they would choose the anterior approach.
Dr. David Christ with us, a Bronson Orthopedic and Joint Specialist. Dr. Christ, let me ask you, because this is, we've had so many advancements in medicine, obviously. What do patients, if they do face surgery, how much downtime are they expecting? I mean, is it drastically reduced? They're up and around maybe a lot earlier than they thought?
Oh, crazy different. Like when I was an intern and a resident, people would be in the hospital for, 10 days, 12 days, something like that. Pretty commonly, we'd wait 3-4 days before we got them out of bed. And nationally and even at Bronson, within the year, I think we'll be doing outpatient hip replacement surgery, if you can imagine.
Wow.
So our patients get physical therapy the same day. And my patients, it's well into the high 90% of my patients go home in the next day.
Wow, that's amazing.
And then at 3 weeks, which is the first time I see them, I would say certainly way more than half, close to 75% of the patients are off all support, meaning they just walk in, no cane, no crutch, no nothing. And some of the ones who are still on the cane or the crutch are still there because they think that I might be mad at them if they walk in without it. So,
well, what can a patient do, Dr. Chris, to help prepare, for hip replacement?
Well, so we try to, if it turns out that they're a candidate for hip replacement surgery and they've chosen to proceed, then they get a very detailed book from us, which kind of brings them up to speed on everything, what to expect, how to prepare the home, exercises that we're going to expect them to do both before and after surgery. And then we actually require them to go to a class or a course, preoperative class that is conducted by one of our nurse navigators, and they are encouraged, again, required, to bring a family member or a friend deemed the coach, to kind of have two people there to help them understand what to expect, how to prepare, what are the exercises, and kind of help them through that recovery process. So that's something that has been coined Prehab, and we believe that teaching patients to do their exercise is the most effective way to, a lot of exercise frequently throughout the day usually trumps going somewhere for a half an hour twice a week or something like that.
All right. Now, we mentioned this earlier. There's a program coming up at the Bronson Athletic Club on November 15th, which is a week from tomorrow, 6:30. It's called All About Hip Surgery, including the anterior approach. And I'm guessing, Dr. Chris, that this is aimed at people who want more information, possibly considering surgery or whatnot. So if they're thinking about attending, do they have to register ahead of time?
I believe they are supposed to register ahead of time.
Okay, and where can you go?
You go to bronsonhealth.com/classes, or you can call Bronson Health Answers. That's 269-341-7723.
All right, if someone can't make the program, how can they obtain additional information?
Again, by going to the website, they can go to bronsonhealth.com and then /joints and then -BMH. We've got some videos up and some patient education material there, including even the exercise videos for the practicing before and after surgery.
All right. We've been talking with Dr. David Christ. He's an orthopedic physician and surgeon with Bronson Orthopedic and Joint Specialist. Again, Tuesday, November 15th at the Bronson Athletic Club. It is free, but you need to register bronsonhealth.com/classes or call 341-7723. Dr. Christ, thanks again for joining us. We'll look forward to talking to you again soon.
Thanks for having me on the program.
All right. Take care. All right. Again, bronsonhealth.com/classes or Bronson Health Answers 269-341-7723. It is 590 WKZO.